experiencing this pandemic as a public health major was really interesting. Obviously, it was something that no one saw coming. When I went into the field of public health, I was expecting to work more on chronic diseases. I did not expect a pandemic like this. But I think one of the most impactful experiences in that was interning at the Indiana State Department of Health in the SNAP Ed division during the COVID pandemic, so that first summer of 2020. So I really got to see these decisions being made in real time, and I got to sit in on meetings and see how that process played out and how policy was implemented in real time, and just the ways in which people were trying to make the best of the resources they had. So my plans for after graduation have recently changed. Originally, I applied early decision to IU Med School and I was accepted, and I was super excited about that. And then I kind of reflected over the course of this year, and I decided to defer that acceptance for a year to go pursue my master's in global health at Trinity College Dublin in Ireland. So I'll spend the next year in Ireland, and then I'll come back to Indiana for med school at IU. So I'm president of Purdue's karate club, and we had to make some massive shifts due to COVID, and that experience just really taught me a lot, and going to practice every week kept me accountable, kept me connected, and I'm just so grateful for that, because I think that probably enhanced my time here at Purdue for these last years more than anything else. I think my proudest accomplishment as a Purdue student has been becoming president of karate club, because that was a gradual process. I had no martial arts experience when I first came here to Purdue, and just kind of seeing myself grow in that way and grow for myself and comparing to my past self. I think that has been probably my proudest accomplishment, even though it's not necessarily as tangible as other accomplishments might be, but it's taught me so much. I really like working in public health because it gives us a way to improve lives on a massive scale and to change systems to improve outcomes, and I really like combining that with individual focused clinical practice. So my future career is going to combine clinical practice and public health, and I'm just really excited to improve lives from both sides of that equation.